Well, good morning, dear friends. Hope you must have liked my previous lecture on separation anxiety. So let's continue with the previous one. I'll start with a case of mine. It was a case of a 9-year-old Ahmed. Name has been changed. Who studied in 3rd standard. The child started developing the violent symptoms of separation anxiety when the school reopened after vacation. The symptoms were fear of being alone, difficulty in sleeping, and he gets up frightened from sleep, after which he is unable to sleep. He frequently complains of headache and stomachache. He refuses to go to school without his mother. Previously, he used to go in an auto with his friends. Throws a tantrum when his mother returned home after dropping him at school. Complaints of loose stools and attacks of breathlessness accompanied by anxiety. Moves anxiously from place to place. Restlessness was there. A recent traumatic event had occurred in the family where his mother was hospitalized for a week. There is a significant history that I found while taking a case. So, shortly I would like to give you guidelines that what was my approach in such kind of a case. I adopted 3 basic things. Psychotherapy. This helped the child learn to understand his feelings and tolerate the separation to a more neutral degree. Cognitive behavioral therapy. This taught the child to change the way he thinks about separation, allowing him to respond more appropriately to natural separation from his mother. And of course, medication. Homeopathic medicine that I selected after taking into consideration the symptoms narrated by his mother, his father, and his grandparents. I prescribed him after repertorization arsenic album 200, one single dose. And to my astonishment, he recovered well with the treatment. There were some brief recurrences of anxiety, but the coping skills learned through treatment were effective at dealing with the problem when it came up the next time, making each instance short and more manageable until the anxiety disappeared completely. The child's self-esteem was strengthened through positive reinforcement, and the whole family supported and helped the child as he was undergoing treatment. So now, let's discuss this anxiety problems in children and what homeopathy can give. Children experience feelings of nervousness, fear or worry from time to time. It's but natural. But these feelings are part of a normal response to a stressful situation. However, when they occur to such an extent that they interfere with normal life, an anxiety disorder may be the underlying cause. Childhood anxiety disorder may be manifested by symptoms such as extreme nervousness, inability to concentrate, poor school performance, and physical symptoms of course like nausea, palpitations, headache, shortness of breath, and sweating. Childhood anxiety disorder can be the result of a recent traumatic or high stress event. Yes, high stress event in children as well. You frequently met with such condition that child is stressed out, such as move to a new home or a school, divorce of a parents, death of a pet or loved one, or it can have no obvious environmental or emotional basis at all. Anxiety disorder in children is treated most successfully when treatment begins early. And treating anxiety may include a combination of talk therapy, positive reinforcement, and in some cases medications. Being a child psychologist as well, I do prefer to give psychotherapy and cognitive therapy along with, of course, homeopathic medicines. It always complement the action of remedies. So it's my sincere advice that our job is not to just select a homeopathic remedy and just give it to the child and wait for the result. But apart from that, we should give him a bit of a psychotherapy and of course a cognitive therapy. So now let's discuss symptoms of childhood anxiety disorder. Anxiety disorder can be difficult to recognize because symptoms are often attributed to other factors like social anxiety and all. And if you come to signs of anxiety that we frequently find in number of patients, particularly children, are extreme nervousness and restlessness, and inability to concentrate, poor school performance, difficulty relating to peers, irritability, and physical complaints such as nausea, upset stomach, and frequent headaches may indicate an anxiety disorder. Now the question is, what are the causes of childhood anxiety disorder? Medical researchers have not yet fully uncovered the causes of anxiety disorder. There is some suggestion of hereditary link, though it's not well proven, as anxiety and other mental disorders tend to run in families, and studies have located small differences in areas of the brain that influence anxiety. But it's not well proved, mind well. And next question is like that, how to diagnose childhood anxiety disorder? Anxiety diagnosis is based mainly on observations by the doctor and parents. While there are no laboratory tests that can pinpoint anxiety disorder, certain tests may rule out another underlying medical cause of the symptoms. Some of the most common types of childhood anxiety disorder includes obsessive compulsive disorders, phobias. Phobias may be irrational or overwhelming fears, separation anxiety disorder, post-traumatic stress disorder, and of course panic disorder. All these conditions usually affect children between the ages of 6 and 11 years. Coming back to the treatment of anxiety in children is more effective the sooner it is addressed after the appearance of symptoms. The most common form of treatment is psychotherapy and teaching positive reinforcement techniques. Medicines may also be prescribed for children with anxiety. Now let's discuss the commonest homeopathic medicines and their indications when it comes to anxiety in children. The first and our favorite medicines of various stalwarts in our past is ACONITE napellus. In ACONITE napellus, we often see a panic attack that comes on suddenly with very strong fear, even fear of death. A state of immense anxiety may be accompanied by strong palpitations, shortness of breath, and flushing of the face. Sometimes a shaking experience will be the underlying cause. Strong feelings of anxiety may also occur when a person is just beginning to come down with a flu or cold. Next remedy is ARGENTUM NITRICUM. Here in ARGENTUM NITRICUM, anxiety develops before any big event, like an exam, an important interview, a public appearance, or social engagement, or a stage performance, or any other big event. Here, we often see dizziness and diarrhea may also be experienced in children. And children who need This remedy are often enthusiastic and suggestible, with a tendency toward peculiar thoughts and impulse. They often crave sweets and salts, which usually make the symptoms worse though. Next is arsenic album. These are the children who are deeply anxious about their health and extremely concerned with order and security. Obsessive about small details and very neat, they may feel a desperate need to be in control of everything. Panic attacks often occur around midnight or the very early hours of the morning. The child may feel exhausted, yet still be restless, fidgeting, pacing, and anxiously moving from place to place. These children may also have digestive problems or asthma and accompanied by anxiety, of course. Next remedy that comes to my mind is CALCAREA carbonicum. Yeah. This remedy is usually indicated for a dependable, solid people who become overwhelmed from physical illness or too much work and start to fear a breakdown. The thoughts can be muddled and confused when tired, which adds to the anxiety. Worry and bad news may agitate them, and a nagging dread of disaster to themselves or others may develop. Of course, we usually see fear of heights and claustrophobia are also common among these children. A child who needs this remedy is often chilly and sluggish, has a craving for sweets and is easily fatigued. GELSEMIUM is the next remedy. In GELSEMIUM, we often find feeling of weakness, trembling and mental dullness, as if being paralyzed by fear. It is often helpful when a child has stage fright about a public performance or interview or feels anxious before a test, like anacardium or maybe ARGENTUM NITRICUM. A visit to a dentist or any stressful event. Chills, perspiration, diarrhea and headache will often occur with nervousness. And we often found fear of crowds, fear of falling and even a fear that the heart might stop or other indications for GELSEMIUM. IGNATIA AMARA. Here we found a sensitive child who is anxious because of grief, loss, disappointment, criticism, loneliness, or any stressful emotional experience. A defensive attitude, frequent sighing, and mood swings are other indications that we usually see in IGNATIA children. At times, the child may burst unexpectedly into either tears or laughter. Headaches that feel like a nail driven into the side of the head and cramping pains in the abdomen or back are often seen when this remedy is needed. Next remedy is PHOSPHORICUM. When a child has been exhausted by overwork or illness and feels a deep anxiety and inability to cope, this remedy may help. The child is jumpy and oversensitive. Mind well, he is quite oversensitive and may be startled by ordinary sounds. Fear of sounds, fear of ordinary sounds, hearing unpleasant news or thinking of world events can aggravate the problems. Insomnia and an inability to concentrate may develop. increasing the sense of nervous dread. Eating, warmth, and rest often bring relief. Physically, we found headaches, backaches, and nervous digestive upsets are often seen when this remedy is needed. Next remedy is LYCORODIUM. Children here likely to respond to this remedy may feel anxiety from mental stress and suffer from a lack of confidence. They can be self-conscious and feel intimidated by people they perceive as powerful, yet may be domineering towards those with whom they feel more comfortable. Taking on responsibility can cause a deep anxiety and fear of failure, although the person usually does well once started on a task. Claustrophobia, irritability, digestive upsets, and with gas and bloating and a craving for sweets are often seen when the remedy is needed. Next remedy is NATRUM. Here we find deep emotions and a self-protective shyness can make this children seem reserved, aloof, and private. Even when feeling lonely, they tend to stay away from the social situations, not knowing what to say or do. And they are easily hurt and offended. They can brood, bear grudges, dwell on unhappy feelings, and isolate themselves, refusing consolation even when they want it. They are often sympathetic listeners to other people's problems. Claustrophobia is also there, and anxiety is especially at night, with fears of robbers or intruders. Migraines and insomnia are often seen when this remedy is needed. Phosphorus is the next remedy. Children who need this phosphorus are open-hearted, imaginative, excitable, easily startled, and full of intense and vivid dreams. Strong anxiety can be triggered by thinking of almost anything. Nervous and sensitive to others, they can overextend themselves with sympathy to the point of feeling exhausted and spaced out or even getting ill. They want a lot of company and reassurance, often feeling better from conversation or a backup. Easy flushings of the face, palpitations, thirst, and a strong desire for cold, refreshing foods are other indications for phosphorus. Another anxious child is a pulsatilla child. Children who need this remedy often express anxiety as insecurity and clinginess, with a need for constant support and comforting. The child may be moody, fearful, whiny, even emotionally childish. Getting too warm or being in a stuffy room often increases anxiety. Fresh air and gentle exercise often bring relief. And anxiety around the time of hormonal changes you often see in puberty, menstrual periods, or menopause often is had with pulsatilla. And the last remedy that we'll discuss today is Cilicia. Children who need this Cilicia are capable and serious, yet are also nervous, shy, and subject to bouts of temporary loss of confidence. Anxiety can be extreme when they are faced with a public appearance, interview, examination of any new job or task. Worry and overwork can bring on headaches, difficulty concentrating and states of exhaustion, oversensitivity and dread. Responsible and diligent, they often overreact and devote attention to tiny details, making their worries and their work more difficult. They often have low stamina and come down with colds, sore throats, or other illnesses after working hard or being under stress. So these are the basic remedies that we usually prescribe in such cases. We will continue with this separation anxiety in our next session, probably next week. Until then, take care and believe in homeopathy. All the very best and see you next week. Till then, goodbye.